room and provide us with some privacy. Hello, my name's Danielle. I'm going to be your nurse today. And what is your name and date of birth?
Unintentional 1/17/94.
Perfect. And do you know where you are?
Really good tech
And why?
for a physical exam.
Great. My patient is alert and oriented ×4. So you're right. You're here today to complete a full head-to-toe assessment. So first I'm going to start by asking you, are you in any pain at all?
No.
On a 0 to 10 scale?
0.
Okay. And do you have any allergies to any food or medication?
No.
None at all? Perfect. Okay, so what I'm going to do is I'm going to start by getting your BMI, which is your height and weight. So you can come with me. Have you step right on the scale here. Okay, you can go ahead and step up and turn around. I'm just going to get your height and step back on. Okay, and go ahead and step down. Perfect. So my patient's height is 5'4", 134, and that makes her BMI 21, which is in normal limits. Now, I'm just going to check your mobility and gait. So if you could just first walk on your toes and your heels, heel to toe. Wonderful. Now I'm going to check your Romberg sign. So if you could just keep your eyes open for about 10 seconds and then close them. All right. And now we're going to do that again with our feet sort of intertwined. And open. And close. And one more time, just heel to toe. Yeah. All right, and again, that was just checking my patient's Romberg sign. Now I'm just going to get her waist circumference. So I'm just going to use this tape and check the circumference of her waist. Perfect. Okay. And before you sit, I'm just going to take a look at your spine. So if you can just bend over to your toes, and I'm just going to palpate her spine, looking for lordosis, kyphosis, or scoliosis, and my patient is negative of all three. Now I'm just going to take a look at her pelvis, and it's perfectly symmetrical. So now you can have a seat on the edge of the bed. And we will begin our assessment with the cranial nerves. So can you smile, frown, wrinkle your forehead, puff out your cheeks, stick out your tongue left to right? Perfect. And shrug your shoulders for me? Awesome. Now I'm just going to don some gloves and take a look at my patient's scalp. This here I'm going to be looking for any bumps, any bruising, or any infestation. I'm just going to palpate your scalp, and I don't feel any sort of bumps. And I'm going to inspect the area, and it looks free of any infestation. Okay, next I'm going to take a look at my patient's ears. I'm just going to look inside. Looks free of any drainage bilaterally. I'm just going to palpate your pinot, looking for any bumps. Perfect. And it looks symmetrical on your face. Next, I'm going to take a look at your eyes. And if you can just look at me, this might be a little uncomfortable for a minute. Perfect. Perfect. My patient's sclera looks white and moist, and the conjunctiva looks pink. Okay, now I'm going to have you follow the tip of my pen as I make an X and a T. Perfect. My patient's eyes and pupils are round, equal, reactive to light, and accommodation. Also at this point, if I had an otoscope, I would be looking for the tympanic membrane in my patient's ears, and the pinot would go up and back, and up and back. Okay. Next, I'm going to take a look at your nose and your mouth. So my patient's nose looks proportioned on her face. And I'm just going to also check there for any drainage, which my patient is negative of. And I'm just gonna check your patency, so if you can just blow and blow. Perfect. Now I'm gonna take a look inside your mouth. Do you wear dentures?
No.
No? Okay. So my patient's lips, tongue, and gums look moist and pink. I'm just gonna have you stick out your tongue and say ah, and my patient's uvula looks back and forth as it should. Next I'm gonna take a look at my patient's neck, and my patient's color is pink. Her temperature is warm. Her skin is dry. Skin turgor is within normal limits. And next I'm going to move on to checking your anterior thorax, and your posterior thorax. So for your anterior thorax, I'm first going to start by just palpating the area. Any pain anywhere?
No.
Okay. Percuss the area. Okay. I'm just going to listen to the lung sounds. Just going to take some deep breaths for me, okay? My patient's breath sounds are normal and her respirations are easy at 14. Before I move to the posterior thorax, I'm just going to inspect your trachea, make sure that it is aligned right in the middle. And you can go ahead and swallow. All right, no inflammation of the thyroid. Perfect. Now I'm going to move to the posterior thorax. Okay, so back here, going to do the same and just palpate as I did on the front. Okay, and you're just going to feel that percuss again. Okay, now I'm going to take a listen. So if you could do the big deep breaths again for me. Perfect. So my patient's breath sounds are normal anteriorly and posteriorly. Now, every time you feel my hands on your back, you're just going to say the word 99, and this is just checking your tactical formitis.
99, 99, 99.
Perfect. And lastly, on the posterior thorax, I'm going to check your thoracic expansion. So if you could just take a big deep breath. Perfect. Okay. Now I'm going to put you at a 45-degree angle on the bed, but first I'm just going to go through your pre- and post-auricular lymph nodes, submaxillary, and your supraclavicular, all negative. So I'm just going to have you lay on the bed, and I'm going to put this up to a 45-degree angle. And I'm just going to raise the bed a little bit. Okay. So now I'm just going to be listening to your heart sounds. And before I go ahead and do that, I'm just going to check for any jugular vein distension. So if you could just look that way and look this way. Perfect. And then I'm just going to take a listen for your carotid artery for any bruit. Okay, and my patient is negative. So now I'm just going to be listening to your 5 heart valves, okay? So I'm just going to have you breathe normal for me. I'm going to listen with my diaphragm and then with my bell. Okay, and lastly, I'm just going to take a listen to your apical pulse, which is at the midclavicular line in the 5th intercostal space. Okay, and my patient's apical pulse is regular. Okay, now I'm going to go ahead and check your pulses. I'm first going to start with the temporal. Okay, and the carotid. One at a time. Okay, and the brachial bilaterally. Okay, and the radial bilaterally. Okay, and now I'm just going to assess my patient's fingers. Here I'm just checking for capillary refill, and it looks normal, less than 3 seconds. And normal on that side as well. And here I would just be looking at the patient's fingers, and I see no sign of clubbing. Now I'm going to check my patient's bilateral pedal pulses. Okay, and both are strong. Then I would be checking my patient for the capillary refill of the toes. So it's the same as the fingers, less than 3 seconds. And my patient is less than 3 seconds for that capillary refill. Lastly, over here, I'm just going to check my patient's plantar reflex. Okay, and my patient has a normal reaction. Okay, are you feeling nauseous? Feel like you're going to vomit at all?
No.
No? So you're okay if I lay the bed down flat?
Yes.
Okay. So I'm going to go ahead and lay you down flat. And here I'm going to be assessing your abdomen. Okay, so you can just put your hands by your side, and I'm just going to take a look at your abdomen. My patient's abdomen is flat. I'm going to listen to the 4 quadrants for your bowel sounds. And my patient's bowel sounds are active. Next, I'm just going to percuss those same 4 quadrants. Just let me know if you have any pain. Any pain or discomfort?
No.
Okay, now I'm just going to palpate lightly. And here I'm looking for any masses or distension. And still no pain.
No.
Okay, I'm just going to go around one more time, a little harder, a little deeper. And still no sign of masses or distension. And you're still okay there? Okay. So now I'm just going to have you sit up, swing over to the side of the bed. Fix yourself. Non-slip socks, which is perfect. So I'm just going to lower this bed. And lastly, I'm going to be checking your musculoskeletal system. Okay? Okay? So, can you extend your arms? Perfect. And rotate your wrists. And rotate your arms. Okay. And can you squeeze my fingers? Awesome. My patient's strength is great. Can you push up on my hands? And down on my hands? Perfect. And down. And up. Okay. And that is the completion of the physical assessment.
So this part of the video is going to be demonstrating the evaluation of your deep tendon reflexes. You want to make sure that you're checking reflexes, that the patient is relaxed, but that the tendon is on some kind of stretch, otherwise you won't get a reflex from it. So we want to make sure that we test them in both upper and lower extremities, and we test them bilaterally. So we're going to start with the upper extremity and the biceps reflex. So this is a reflex on the biceps tendon. And what we want to do for this one is, again, the patient's arm is to be sort of relaxed in the patient's lap. And I'm going to put pressure on the biceps tendon in order to stretch it a little bit. And then I'm going to strike the tendon with the reflex hammer on my own finger. I should be able to feel the reflex in my hand, even if I can't see it in the muscle contracting. Alrighty. Again, for that one, you could see the arm jumping, but I could also feel the reflex myself. When you're doing the reflex, make sure that it's a quick, rapid, it's not a flunk down and hold it, it's a quick, rapid tap. So we'll do that again. And again, we want to make sure that we do that bilaterally. Alright. So we also want to be able to do the triceps reflex. For the triceps reflex, again, we need the arm to be relaxed, but the tendon to also be under some stretch. So we need the arm to be bent. So generally we will hold the patient's arm out to the side and have their arm bent. And let me hold as much of the weight as I can. Okay. And again, strike the triceps tendon with the reflex hammer directly. And again, you notice a slight swinging of the arm out laterally when that's struck. And again, make sure you do the same thing on both sides. And so just relax the weight into my hand. And you notice the slight jerk of the arm outward. So finally, we're going to do the patellar reflex and the Achilles reflex in the lower extremity. So for this one here, make sure you find the patellar tendon and just relax your leg as best as you can. And the same thing on the other side. So this patient has good brisk reflexes. They're not hyperreflexic, but they're easy to see. Some individuals' reflexes are much more subtle than that and a little harder to see. Finally, we want to do the Achilles reflex. If I let the leg dangle like this, the Achilles tendon is relaxed and not under any stretch. So you want to push up on the foot so that the tendon is stretched. And it's generally easier to strike it with the back of the hammer, but you can strike it with the foot. So again, just relax as best as you can. And then the same thing on the other side. Try that one more time. All right. So the next reflex we want to do is the plantar response reflex, which is also referred to as the Babinski. So what you're going to have the patient do is, if you could move back on the table a little bit for me, and I'm going to pull out the footrest. And so you want to do this is you're going to run an object relatively firmly across the dorsal aspect, the plantar aspect of the foot. And you want to make sure you use something clean and new each time so that you're not, again, transferring things back and forth between patients, because this is a relatively firm pressure. So we generally use a new tongue blade for that. What you're going to do is on the sole of the foot, you're going to run the tongue blade up the side and towards the midline. You want to do it relatively quickly and with decent pressure. This isn't a tickling motion. You want it to be relatively firm. And you want to watch for the direction that the toes curl. All right. So I'm just going to run this tongue blade across the bottom of your foot. Now you notice it was a subtle motion, but his toes curled towards the plantar surface of the foot. So toes down going is the normal response. If, when I did that motion, his toes pointed upwards, that would be upward going toes or an abnormal response to the Babinski.